الاتش بتاعتها بتقل، العيانه بتشتكي من دراينس، بتبقى فيري دراي. ولو انتوا شفتوا عيانه افتر بقى 10 years of menopause she will come and complain I am closing، ساعات ما تبقاش عارف تدخل ايدك فيها she is closing، وده بسبب ان حصل لها كومبليت ريدكشن في الانتجريتي عشان الاستروجين اللي قل. شايفين المنظر ده؟ طبعا العينين دول مش معمول لهم حاجه. ده typical picture dry unhealthy skin. دي مش احمرار هيلثنس، لا ده اتس لوكس لايك التهاب unhealthy skin. اوكي طيب العيانه هتشتكي من ايه بقى في الحالات دي؟ هتقول لك انا بقى عندي urinary incontinence، هتقول لك انا بقى عندي انفكشن، انا بقى عندي ديسبارونيا، بقى عندي ديسيوريا اتروفي. ودايما العيانين في السن ده تيجي تقول لك انا ما كنتش عندي الكلام ده قبل كده، انا جد عليا الكلام ده افتر ذا بروبلم، انا حصل لي كده. اوكي طيب يبقى دي كلها مشاكل هتيجي للعيانه. دي عيانه مثلا، شايفين الفرق بين الاحمرار اللي هناك والاحمرار اللي هنا؟ this is the difference. it looks wet moist healthy. اوكي this is what should be، ده اللي المفروض ان العيانه تبقى عليه. why we deal with the vagina or the female intimate system as it knows part of his body؟ ما هو زي السنان وزي المناخير وزي البق وزي في ايه؟ why it should be bad؟ ليه احنا لما اسناننا بتقع بنروح نصلحها في حين ان احنا لما بيحصل لنا فاجينال اتروفي ما بنصلحوش؟ it's part of our body. it's not only related to sexual function. الست اللي عندها دراينس ما بتعرفش تقعد في الشغل، الست اللي عندها هوت فلاشز بتسيب الاجتماعات وتخرج، الست اللي عندها ستريس انكونتيننس بتجري على الحمام وبتقعد في حته جنب الحمام. اتس نوت يعني جود كواليتي اوف لايف. اوكي يعني ايه ريجوفينيشن بقى؟ يعني ايه ريجوفينيشن؟ ريجوفينيشن it means to bring what the past again. يعني ان احنا نرجع عقارب الساعه. والله العظيم مع عقارب الساعه الحقيقه يعني هي مش
reduce some disease recurrences like we talked yesterday about candidosis, for example, or for some cystitis that's inflammatory and not with bacterial, and improves fertility, and in some time it's an alternative to some surgical treatment. When you start in regenerative medicine, everyone recommends that the first thing that you should know about is the PRP, because it's easy to use. It's not expensive to have like devices that is more expensive, but the PRP kit you have like you need some tubes and a centrifuge, so it's not so expensive. The recovery time it's immediate, so after this the patient can go back to work or whatever she had to do in that day. It is safe because you use the material of the patient. The risk of allergy, of course, it's a minimum. It does not require anything surgical. It can be combined with other types of procedures. The contraindications are not so many, and I will show you. And as we said, it can be used in a large scale of areas of medicine. So this is simple. We have 3 steps: take the blood, centrifugate, inject it. Okay, so basically it is not something complicated. This is the same what Prabhu showed you, because this is the EIAUG protocol. So you take an amount of blood. You have to calculate. You remember yesterday I told you that when you have the consultation, the first consultation of the patient, you should write what you found there and what you want to treat. For example, you think, okay, I want to treat the introitus, I want to treat the episiotomy scar, I want to treat the endometrium, I want to treat the clitoris. So because after this you can think, okay, how many milliliters of blood do I need? Okay, not to put some and then say, oh, okay, I had to inject here as well, I don't have anything left. Okay, you have to organize before. So just to have in mind, and it's very important the quantity of the water that the patient drinks. So she has to drink at
definitely
least 2
the
liters
plasma is one of the component in which we are talking about the platelets, the concentration. That's why either it's a platelet rich plasma or platelet poor plasma. So, it depends on the concentration, number of cell counts of the platelets inside the plasma. So, definitely we need to separate first the RBC and the plasma part. In the plasma, now what is the platelet rich? What does it mean platelet rich? Platelet is already inside. So, what does it mean the platelets? Because you have taken the blood from the patient, centrifuged it, you are not going to change the number, but you are going to concentrate the number. So, that means in a limited volume, when you are concentrating something, that is from the baseline. Let us say I have in my sample I have the platelet count is 105,000, just an example. Once we have centrifuged it, from the baseline we achieve 300,000 in a minimal volume. We have the volume of the 5 cc in which without centrifuge
handle it, not gone. So not like that. Put that inside. I'm
You can turn your hand.
okay. You see, I'm sticking it. So little, slowly, because of the gentle toxin. Induced new collagen production, supports tissue matrix, provides water absorption. It's important for the augmentation. Moist the area where it is in, and is a powerful antioxidant. It has both regenerative and volumetric effects. And hyaluronidase is also a natural enzyme of human body that biodegrades the hyaluronic acid. Today we have the chance to produce both HA and hyaluronidase in vitro conditions. So it's also, this is the new knowledge about hyaluronic acid. HA is a critical regulator on cell behavior. It is not only a structural member of extracellular matrix, but also has the essential effects on cellular metabolism. What does it mean? It has a dynamic turnover in the circulation. Its half-life is about 3 to 5 minutes in the tissue or circulation. Has a significant effect on early stage of wound healing. It has an important signal molecule, and fragmented HA has major influences on angiogenesis and inflammation. It has receptors on cell surface, like you can see here, also including the CD44. Has also HA is involved in malignant progression, and the aggressiveness of the tumor correlates with level of HA and the cancer cell surface. HA fragments have a wide variety of biological functions that are entirely size specific. And I just want to talk about a little bit what is cross-linking, because you know, here we have natural HA molecules, but its turnover, its half-life time is 3 to 5 minutes in body. So, but we want the HA molecule stay there more. So we need to link to each other. Then it will stay there more long-lasting. Okay. So we use for it, this is the technology, BDDA. It's mean 1,4-butanoediol diglyceridyl ether. Okay. You can see the ether is an inert material for body. So we don't like it, ether. Not because it's make hard to work some of our organs, liver, kidneys. Okay, it's make a hardness to work. So we don't like it, but it's a rule that if you want to stay there. So this is the technology. How can we use? No.
Again, we'll go here. Yes, the gas is going in. Is it visible? See. Is it visible? You can see yourself? No. No? Is it painful? So I am between 15 to, I'm so very superficial. So the gas passes itself in the whole tree. It is going. Every machine has got different way to work. Painful. Oh. So after some time you can change the needle because it becomes blunt with a few. Just a minute. I'm trying that you won't have much pain. Yes, it's done, I think. Yes, again it's, see, I'm going in and it's, yes. Sorry. Yes, see how the gas is flowing. Few are here also. Should I do? See how beautifully it is going in. It can be used in different scar marks also. Yes, you are having some cesarean scar mark? Yes, she is having, we can show. Just hold this like this. The dark, yes, it's going in. Yes, we'll go like this. See. So here the effect would be of decreasing the darkness. That means hypopigmentation. A little, I'm really sorry if you are. But it is going to give you the result. Yes. Because here the effect is not there. That is why. Just see. It is going to be filled inside.
بتحرق شويه بعدها بس ان شاء الله تلاقي نتيجه كويسه. Just subcutaneous.
Just subcutaneous, yes.
Submucosal also on the vagina. Submucosal.
Yeah, submucosal only. It rejuvenates.
It works in vulvovaginal atrophy.
Yes, of course. Because it is now creating the need of oxygen. Very much of oxygen from your own body, from your own blood will be delivered over here. And these scars, yeah, see. It's very easy one, few sittings and you will see the result. Okay, I think we are done.
How many times between every other sitting?
7 days. 7 days we
Is
ask.
enough.
Yeah, 7 days
Maybe
is enough.
4 or more sessions?
4, sometimes 6 sessions are needed. Depends on it's a cover. She needs something. You're having pain?
معلش بس ان شاء الله الدنيا تبقى جميله باذن الله.
Components are sexual orientation, gender identity. That is what is needed. Sexual expression, relationships and pleasures. So yes, the whole world is male dominated world, okay? Males decide how to live, where to go, how to do, what to do, how much is for you. Is this something ridiculous? Everybody is born with his or her own rights to live his or her own life. So this is something. Sexual health is physical, mental and social. 3 things are there. If I am okay. And so what we have to evaluate once a patient comes to you as a gynecologist, nothing like cosmetic gynecologist. You have to see if she is having any vaginismus. Vaginismus has got a different definition and different presentation. I'll show. Vulvodynia, some sort of pain, vulval pain. Vulvovaginitis, this is very common. Many patients come with intractable vulvovaginitis. Every time you are treating them and every time they are coming back, because, and there comes the role of your laser, energy based devices. They are going to help in a way because they do resurfacing. The whole skin is replaced, the upper part of the epidermis is replaced by the regenerated newer skin, and that is why the more supple, beautiful, the rejuvenated one, everything becomes good. So the infection is also gone, because most of the times it is fungal, super infected by bacteria and other things, and that fungal infection is located or limited only up to the dead skin. You know, fungal infections very rarely they become disseminated, systemic. Most of the